Welcome to Fempower Health. This is Georgie. Today we're talking about a quiet revolution in women's health that most people still haven't heard about. How removing the fallopian tubes, not just tying them, is becoming a new way to reduce ovarian cancer risk. It's called salpingectomy, and it's replacing tubal ligation in more and more surgical settings. But here's the problem. 1, most women don't know it's happening. Then, many don't realize what surgery they've actually received, and the system hasn't made it easy to access or understand. In just a few minutes, I'll walk you through what's changing, why it matters, and what questions to ask if you're ever offered a procedure like this. If you're listening right now, I just want to thank you. You're taking time to learn, advocate for yourself, and understand your body, and that matters a lot. And if this episode helps you, I hope you'll pass it on to someone else. The more we know, the more power we have in the exam room and in our own lives. So let's get into it. What if ovarian cancer doesn't actually start in the ovaries? That's the revelation driving a quiet revolution in gynecology, and why a growing number of OBGYNs are removing fallopian tubes instead of tying them. And this matters a lot, and most people don't know it's happening. Here's what every woman deserves to understand about this critical shift in cancer prevention. What's going on? Doctors have long referred to high-grade serous ovarian cancer as a deadly disease of the ovaries, but research shows that in most cases, up to 70%, these cancers actually begin in the fallopian tubes. Now, more doctors are recommending opportunistic salpingectomy, which is removing the fallopian tubes during common procedures like tubal ligation or hysterectomy, even in a woman without a high genetic risk. The goal? Prevent ovarian cancer before it starts. Why is this happening? Decades of pathology studies have revealed that precancerous cells often develop in the fringed ends of the fallopian tubes, especially in women with BRCA mutations. These damaged cells can migrate to the ovaries, where they grow undetected until it's too late. There's no effective screening for ovarian cancer, no pap smear, no mammogram equivalent. That makes prevention especially critical. What does this mean for patients and doctors? Tubal removal is replacing tubal ligation. So instead of tying tubes, many doctors now remove them entirely, but not all providers explain the difference, and not all patients know what they've received. Insurance coding has lagged behind. Until now, there was no diagnostic code to specify salpingectomy for cancer prevention. That meant limited coverage, confusing medical records, and even denied claims. Some patients report unexpected side effects or find out later they had their tubes removed when they thought it was reversible. Others are deliberately asking for tube removal to reduce cancer risk, but are told it's not covered unless coded a certain way. What's changing now? Thanks to advocacy from Dr. Rebecca Stone of Johns Hopkins and others, there's new diagnostic codes which are launching October 2025 to clarify the why behind tubal removal, especially for cancer prevention. This could improve insurance coverage, informed consent, and public understanding. Research from Canada and Sweden suggests salpingectomy may significantly reduce ovarian cancer risk without triggering early menopause, which happens when the ovaries, not tubes, are removed. What this means for you? If you are planning a hysterectomy or sterilization, or advising someone who is, first, ask your doctor whether salpingectomy is appropriate and whether they recommend removing tubes instead of ligating them. Next, clarify what's being done and whether it's reversible. And lastly, push for full informed consent. You have a right to know what's being removed and why. So if you'd like to help continue changing the narrative in women's health, please do follow the Fempower Health newsletter for weekly insights interviews, and tools to advocate for better care, from exam rooms to boardrooms. Let's stop treating women's health like a charity. It matters, and we need the attention and investment dollars to show this. Thank you so much for joining me today. Please do pass this along to anyone who might find it beneficial, and thank you again for your support. Thank you for joining me today on Fempower Health. If you'd like to continue the conversation, please follow me on social media. I am most active on Instagram, LinkedIn, as well as TikTok. You can also subscribe to the weekly newsletter if you want to stay off social media to get the latest and greatest updates. And you can find a link to that either on my website, fempower-health.com, which is a hub to all the different health topics I've covered over the past 5 years, or you can go to the show notes where there's links to all the helpful resources that are relevant to this discussion. And if you know of someone in your life who would benefit from this information, please do pass this along, because that is how we can ensure this important information reaches those who need it most. And for anything that is discussed medically, please understand that none of what we share on Fempower Health is medical advice. It is all for information purposes only, and only a conversation between you and your doctor can give you the care that you need. Thank you very much.